Hair loss, especially male pattern hair loss, can be treated at any age. Now, when we're discussing hair restoration, we like to talk to our younger patients a little differently than our older patients. Younger patients might experience more future hair loss, whereas our older patients are probably stable in their hair loss. When we're addressing hair restoration, in particular follicular unit extraction, when we're using these on younger patients, we will commonly describe saving some grafts for future use. Well, as our older patients who have stabilized in their hair loss, we will commonly plan for more grafts at one time. Male pattern hair loss is due to hormonal changes. A myth is that baseball hats can cause hair loss. That is not true. Male pattern hair loss is due to conversion of testosterone to dihydrotestosterone in the body, and that causes men who are genetically predisposed to lose their hair. The hair will begin to fall out into that male pattern baldness pattern. Hats do not cause hair loss. It's a common myth that hair restoration will give you that plugged appearance. Well, the way we do our hair transplants with follicular unit extraction, we take hairs from the area where you're not going to lose hair and transplant that into areas where you have lost hair. It is very natural because out of each follicle, there's 1 to 6 hairs that come out of those follicles. So we try to match that up with the direction the follicle's coming out with the hair around it. We try and match it up with the numbers. Some areas we need more hair follicles than others. It's very common for us to do that, to try and blend in the hair so it looks very natural. When you look at before and afters, you should see a very natural result. The thickness should be similar to the hair around it. It should not appear as a plug appearance. If you were to transplant someone else's organ, say their liver or their kidney, into someone else, they have to be on immunosuppressive drugs. So we do not take hair from other individuals and put it on one individual because they do not want to go on the immunosuppressive drugs just for a hair transplant. The hairs that we transplant are ones that have not genetically been predisposed to fall out. So these are hairs that will always be there once we transplant them. They go through a cycle. There's a growth, there's a death, and there's a rest phase. Hairs will be in those different cycles at different amounts of time. It takes a full year to see the fuller result from a hair transplant. Now, there are people who can lose hair due to stress. They can lose hair due to malnutrition. So if you're not getting the appropriate nourishment, the vitamins that your body needs, you could lose your hair. Or hormonal changes, thyroid problems, you could have thinning hair. A vitamin will not prevent you from losing your hair. Once again, a vitamin will not prevent you from losing your hair. Short term, yeah, if you're malnourished, you need vitamins. Vitamin C, zinc, biotin, those type of things are needed for hair production, but that is not what causes baldness.